Hello there. My name is Ryan. I'm a registered nurse at United Regional. If you can see my badge on this thing or not. I am a director of patient experience, and I've been a registered nurse for 14 years and worked all over healthcare. But for the last 5 years, I've been serving in this role, director of patient experience. And this is student orientation, nursing student orientation, as it relates to the patient experience. And I'm just going to acknowledge right up front, this is weird doing this on a video. That's all right. We're living in a bit of a different world right now. But I'm going to walk you guys through what it means, what patient experience means at United Regional, why we care about it so much, why it's such a big deal to us, and I'm going to talk to you about kind of what to expect and what you can do to impact that patient experience. So there's lots of reasons the patient experience matters. I think we could go through the monetary reasons. We could go through, retaining patients, etc. But for me, at the end of the day, it really just comes down to it's what our patients deserve. If it's my mom, if it's my grandma, if it's my son, my daughter, my dad, if they're at this hospital, they're getting health care, I want them to get excellent care and caring. And that means they get excellent clinical care and they also feel good about their care. And that's really the gist of the patient experience, is that people would get great care, but they would also feel that caring. And both of those things are extremely important. We used to, in the old days, not really realize how important the caring aspect was, but now there is so much research out there showing that it has huge impact on clinical outcome if patients can feel the care and caring. So a few years ago, at United Regional, we decided we wanted to take that to the next level. We already had good, customer service, so to speak, and we already had good things going. We said, what do we do to take it to the next level? And we got as many times we do, we got our staff involved, and our staff, our frontline nurses, came up looking at best practices with 6 things that we think drive the patient experience. And these are 6 really simple things, and you're seeing them on your screen right now. There's 6 simple things that when we do them regularly, we see massive improvement. And we were able to see some of our numbers go from, and I'm not exaggerating here, go from less than 10th percentile up to 70, 80, and even 90th percentile in nursing communication whenever we rolled these things out. When we rolled these out, we became, when you compare us to other Texas hospitals that are similar to us, there's a list of about 50, we became #1 on nursing communication. And I think it directly relates to us getting real consistent with these things. So for the next few minutes, I'm going to walk you through what the things are on this slide that you're seeing here. And some of these will heavily pertain to you. Some of them may not so much. But when you're here at United Regional, we would ask that you participate in these things as much as you can as a student. And then these things will serve you no matter, we hope that you end up working someday at United Regional, but no matter where you end up, knowing these things will definitely help support you in your career. So let's start with the foundation of all of this. The first one on this list is AIDIT. Many of you have probably heard of AIDIT before, or some version of it. Most healthcare organizations do AIDIT or some version of AIDIT. AIDIT is an acronym for how we introduce ourselves. It's an acronym for how we say hello. Here's the deal. The research tells us that patients decide whether or not they trust us in about the first 6 seconds of an encounter. They go, hey, I trust you, or I don't trust you, in about 6 seconds. That's pretty crazy, and that lets us know that it has very little to do with our clinical care, at least at first. So I'll just tell you, as a student, this made me feel very good when I was like, hey, I don't know what I'm doing. I can still earn and gain trust if I just go in and show that I care. And so AIDIT's a great way to do that. So I'll be real with you. AIDIT has a bad rap sometimes in healthcare, and for good reason. It is a bad rap in healthcare because done wrong, AIDIT can just be weird and robotic and downright creepy, okay? So what I want you to have is a real world, realistic, uncreepy AIDIT. And here's how you do that. You look at each letter as a principle, and we're going to walk through those principles right now. So the A, any of you out there listening, if you're watching this with somebody else, tell them what the A stands for if you know it. If you know what the A and AIDIT stands for. I'll go ahead and tell you. The A stands for acknowledge. So step one, what I want to do is I want to walk in that room and I want to acknowledge whoever's in that room with me, okay? And it's really complex, okay? I hope you get your notepad out. Here's what it looks like. Hi, right? That's all the acknowledge is. Hi, hello, good morning, something like that. A little bit of eye contact, not too much eye contact because that gets creepy, right? Just a little bit of eye contact. Don't maintain too long, and say hi, good morning, hello. Okay, one I'll tell you to avoid, and we do this one a lot, is how are y'all, or how you doing, when we walk into the room. You're going to get burned on that one because they're going to go, oh, I'm not doing good, I'm in the hospital, why don't you quit asking me dumb questions. So hi, good morning, good afternoon, those are all really great introductions. And then if it's appropriate and you kind of take your cues from them, but a lot of people at this point appreciate a handshake. And I'm gonna go and meet the patient. Hi, good morning, Mr. Jones. And then I'm gonna turn and I'm gonna meet everybody else in that room, okay? Here's a couple reasons for this. One, it's just polite, right? It's just a polite thing to do. That family is a part of the care team, and that family can be my best friend, or let's be real, they can be my worst enemy, okay? So I need to get that family engaged as part of the care team. So I'm going to meet the patient, I'm going to meet the family. Again, I'm going to take my cues from them, so handshakes if appropriate, and I'm going to meet everybody. It's polite, but also it's just good clinical practice, all right? I need to know who's in that room with me. Is it wife? Is it girlfriend? Is it baby mama? Are all three in the room at the same time? Because that's going to change the dynamics of this room. And I need to know if I can even talk in front of these folks. So introduce yourself to them, greet them, and then find out who they are. Now, we're going to be very careful about how we do this. We're not going to go, well, now who are you and why are you here? My preferred way to do this is ask the patient to introduce you. If the patient's unable to do so, introduce yourself. Most of the time, they'll introduce themselves back to you. If they don't, then you can politely say, hey, are you friends or family, or how are you related? Okay, pro tip right here. Never assume. I don't care how obvious it looks. I don't care how obvious it seems. Do not assume that it's the wife or daughter or husband or whoever at the bedside. It will burn you. Okay, don't ask me how I know that. Just don't assume. Always find out from them. All right, so that's the acknowledgement. Pretty simple. We just acknowledge everybody in the room. I know this seems like really basic human behavior, but you'd be surprised how we get busy and we miss these simple things, okay? So then I'm going to introduce myself. So I've acknowledged everybody in the room, and some of this is kind of happening simultaneously. Pardon my voice. Then I'm going to introduce myself. So I'm going to tell them a few things. I'm going to tell them my name, and I'm going to say it really clearly so they can understand who I am, because they've seen a lot of other people. So I'm going to say, hi, my name is Ryan, and I'm going to tell them what I do. I'm a registered nurse here at United Regional. And then I'm going to go one step beyond that from my name is Ryan, I'm a registered nurse, and I'm going to be taking care of you for the next 12 hours, etc. And then I'm going to make a statement of positive intent. And this is probably the most important piece of all of this, is right here. It's a pivotal moment for you to gain the trust and gain the encouragement of the family right here, is to say something like, here's the one I use all the time. You can come up with your own statement, but basically what I need you to tell them is I care about you, or I care about your mom, and I'm going to take great care of them. Okay, so here's what I say. I say, it's nice to meet you. I know it's really tough being in the hospital, but for the next 12 hours, I've got you. I'm going to be with you every step of the way, and you just let me know what you need today, okay? And we're going to get through this together. Something along those lines. And you can literally, when you say something like that, it goes a little bit beyond just the normal of, hi, my name's Ryan, I'm a nurse. And then you say, listen, I know it's tough, but I got you today. I'm going to be with you. When you say that, you can see them calm down. You can see them go, oh, thank God I got somebody that sees me as a human being and cares about me. I'm just going to tell you, that's going to make your day go a lot easier if you establish that rapport right up front, okay? So now I've introduced myself to the patient. I've done the same with the family. Now the D and the E, okay? This stands for duration and explanation. I'm going to lump this all together and make it real simple. This is where you do your thing. So whatever you came to do, you're going to do it now. The thing is, you're going to talk them through it. You're going to narrate your care. So let's say I'm hanging an IV bag. I'm not going to just silently put that bag up there. I'm going to tell them, hey, I'm going to hang this IV bag over here. It's normal saline, and we're going to be running it in at a just very slow rate just to keep your vein open. That's all we're doing with this. I'm just going to walk them through that. That's it. Narrate your care and give them as much explanation as they want. Take your cues from them. If they want you to just shut up and they want to go to sleep, then do that. Take your cues, kind of watch them. Then at the end, so we've got our duration explanation, and then the last thing on the list is thank you, okay? Now, thank you is a really good principle to understand. It doesn't mean I'm gonna say thank you every time I leave the room. If you ever have seen like ADIT training before, the original ADIT training would tell you to do something like, hey, thanks for choosing United Regional. And that's a great thing to say if it's an appropriate time to say it. So if I am putting them in the car and sending them home, that's a great time for me to say, hey, thanks for choosing us, or thanks for letting me take care of you. If it's at the end of my shift and I'm about to go home, I could say, hey, it was really nice to meet you. Thanks for letting me take care of you all day today or last night, and I'll see you tomorrow before I leave the room. Those are appropriate times. If the patient just got in and they're puking over the side of the bed and I go, hey, thanks for choosing us, that's not a good time to say that, right? The principle of the T is that I show appreciation to the patient and I close the encounter in a meaningful way. So I've come in, I've acknowledged everybody in the room, I've introduced myself really well and assured them I'm going to take great care of them. I've explained everything in a really great way and I've walked them through everything we're going to do. And then before I leave the room, I show appreciation by maybe saying something like, hey, I'm going to be right down the hall if you need me. You just let me know whatever you need. Here's your call light. Can I do anything else for you before you go? Before I go, I have the time. And I took 10 minutes talking about this. This really only takes a few seconds to talk through that with a patient, and it can make a world of difference, especially if it's your first time meeting them. It's going to make all the difference. So that's ADIT in a nutshell. You'll need to practice it a little bit, kind of work through it, get it down in your mind. But after you kind of get your spiel down, it'll just flow naturally. So I encourage you to start practicing that. It's going to serve you well throughout your whole career. Next on the list is hourly rounding. Hourly rounding it's exactly what it sounds like. Every hour, United Regional, for an inpatient, every hour during the daytime, somebody is checking on that patient. At night, it's every 2 hours. So when we go into that room, we're checking for 3 things. It's the 3 P's. It's pain, potty, and position. Okay. To do an hourly round, you actually have to go in the room and talk to the patient and ask them questions. Okay. An hourly round is not where I poke my head in the door and go, hey, are you okay? That doesn't count for an hourly round. An hourly round means I go in the room and I check on the patient. Do you have everything you need? Are you comfortable in the bed? Do you need to use the restroom? Are your belongings within reach? When we rolled out hourly rounding, we saw a significant difference in our fall rates. Our safety rates went up. Hourly rounding is a best practice across healthcare. So whatever floor you're on, find out different floors do different ways of rounding as far as who takes what rounds when. But find out how they do their hourly rounding and then get in on that. They'll be happy, I promise, to let you help with the hourly rounding. Next on the list is bedside shift report. Bedside shift report is a long-standing best practice in healthcare. It's an absolute game changer for us. And this is that 2 nurses go to the patient's bedside together and they give bedside shift report with the patient involved. So the difference in a good bedside report and a great bedside report is that the patient and or patient family is involved. So you will definitely want to get in on that. If you're here as a student during that time of day, you want to be involved in that report because you're going to get so much information for the day. But we, in the old days, bedside report was done at the nurse's station and nurses just talk together. In this scenario, we go into the patient room and we engage the patient as much as possible in that bedside report. If there's something sensitive that needs to be shared, that maybe there's a lab result that hasn't been shared with the patient yet or something like that, we would share that outside the room. Also, if we're going to do report in the room with the patient, we need to ensure that if there is anybody else in the room, that the patient wants them to be as a part of the report. If not, we can ask that family to step out as well. So that's bedside shift report. Team rounding. Team rounding is the concept it's kind of an old school concept that went away, and then we brought it back because we think it's a best practice. And that is, we try to put a nurse and a doctor in the room together. So when the physician, specifically hospitalist, rounds, the charge nurse or the primary nurse will try to make sure they round with him. So the doctor and the nurse are in the room together at the same time. As a student, I highly encourage you to try to get involved in that. You're going to get a lot of information. The nurse's role in that is really to make sure that the physician and the patient are on the same page, to make sure that the patient asked all the questions that they wanted to ask, that they understood. And then, many times what will happen is the physician rounds, then the family shows up an hour later and they ask the patient, hey, what'd the doctor say? Patient doesn't remember or doesn't know. The nurse can kind of help facilitate that communication and be there to advocate for the patient and the family. Of course, we can always call the physician and ask them to come back if they need to have further talks. So patient welcome video, we'll just briefly mention there is a video out there that for when patients first get admitted, the nurses can show that video to the patient that lets them know kind of what to expect while they're in the hospital. Nothing you need to work on too much with that. And then last thing, and this one definitely will pertain to you guys, is the whiteboard. Whiteboard is it's a very simple thing, but it actually is very meaningful to the patient. One of the reasons it's so meaningful is they sit there and look at that thing all day long, right? They sit there and see that whiteboard all day long. So what are some of the things that the whiteboard does? Well, one, it's a great way to just interact with your patients. Okay, it's a great way. If you walk in and the patient's a little bit, you're not able to kind of break through with them and have a good conversation, or it's a little awkward, the whiteboard's a great icebreaker. You can go over there and say, hey, my name is Ryan, and you can put your name on the board, and here's today's date, and then there's a big space at the bottom of the board for us to just put whatever's relevant to the patient. So on there, find out what's important to them. Do they want to know what their white count is for the day? Or are they really focused on their blood sugars? You can write those things in there for them if they would like you to do that. You can also write plan of care in there, discharge date, whatever is important to that patient, you can put it on the board. Something else I've started to do that carries really, really well is to ask them a fun fact about themselves. What's a fun fact about you that you'd love for the team to know? And I don't know, maybe they play the saxophone. You could write that on the board. Hey, Joe plays the saxophone. One staff member recently drew a monkey. That one cracked me up, but this guy really liked to draw. The staff member drew a monkey on the board for him. That made his day. He was very down and kind of depressed, and when this staff member drew this cute little monkey on the board, it brightened him up. It made his day. He went on and on about how much that meant to him. So those little things like that, man, when people are not feeling good, and that stuff really makes a difference. So look for those opportunities for sure. At minimum, make sure your name is on the whiteboard and that they can see you're a part of the care team. So that's our service bundle in a nutshell. We found these things when we do them all and we do them consistently, they really, really work. Each and every one of those things by themselves may not seem like that big a deal, but when we put them all together, it creates a very powerful package, especially if it's done from people that have a heart for patients, that is coming from a place of caring and love and empathy. When you take those underlying things and you put them with some very objective things like this and do it consistently, boy, it's very powerful, and it shows in our nursing scores. It shows in our culture here. So I would ask you to please be a part of that. We have this saying at United Regional, and if you come to work here, you'll hear it a lot. But one of the things I say is that I am the patient experience, right? So whenever I walk in that room, whenever you are in a room or you're in the hallway passing a family, whatever it is, at that moment, it doesn't matter what badge you're wearing or what color scrubs you're wearing. At that moment, you are United Regional to that person. At that moment, I'll take it one step further. You're healthcare. You're the representative of all of healthcare to that person. So just remember that phrase when you're in the room, when you're on the phone, when you're passing by, like, hey, I am the patient experience. It's up to me to show this family love and show this patient love and care and compassion. And I've given you kind of some practical ways that we do that here at United Regional. So thank you so much for your time. I look forward to seeing you around the organization. My office number is 940-764-3024. Feel free to reach out to me at any time with any questions. You can also just ask any of the nurses to get a hold of patient relations, and they can always get a hold of us at any time if there's anything I can do for you. All right, thank you so much, and I hope you have a blessed semester.